Hi, future nurses! We are less than 2 months from graduation, and some of those skills from early on have started to fade. Jamie and I are here to remind you how to insert and use a feeding tube. Let's start with why. We have been told time and again to ask why, so why would our patient need an NG tube? First off, let's start with indications that we need it to put something into our patient. Feeding is one of the first things we think of, but let's not forget medications can go into an NG tube also. Remember that some preparations like extended release tablets and capsules should not be crushed. Talk with the pharmacy at your hospital if your patient is on a medication contraindicated to NG delivery. Let's not forget our patients on mechanical ventilators. We need a way to get food and medications into them, right? An NG or OG tube is a great way to do this until they recover or a separate method is developed like a PEG tube, but we're not here to talk about those. Secondly, NG tubes can also be used to remove stuff from our patient. We can use NG tubes to suction content from the stomach. This can be used to decompress the stomach in patients who have intractable nausea and vomiting, or who have an intestinal obstruction. Additionally, the stuff that comes out of that tube can be important diagnostically. We and the doctor can use the output of an NG tube on suction to evaluate upper GI bleeds. That's great. Now that we know why, we can get into how, right? Not quite. First, assessment. What you will need for this: a pen light, tongue depressor, stethoscope, and pulse oximetry monitor. First, use the pen light to check the nares. Be sure to ask your patient about previous facial trauma, especially a broken nose or a deviated septum, as this will change which nares you use. Then use the tongue depressor to check the gag reflex and the stethoscope to check vowel sounds. And check your patient's oxygenation. In fact, get a full set of vitals before you get started and leave the pulse ox on. We will need monitoring during the procedure. Okay. We know why, we have assessed our patient and determined we are ready, so now can we do the how? Nope. How silly would it be to walk into your patient's room without any supplies? Is that how you look like a cool nurse? Definitely not. Debbie would be so disappointed. To be a cool nurse, here's what you need for insertion. Doctor's orders. I know, duh, right? But make sure that there's an order for chest x-ray on there too, so you can confirm placement right after the insertion. Next, you need the NG tube. Usually for adults, a 16 to 18 French is most common. For pediatrics, add 16 to the patient's age to get the right French for a pediatric patient. I know, weird, right? We also need a cup of water with a straw, but only if your patient is able to swallow. If your patient is going to aspirate, don't give them water to drink. That's a bad idea. You should also grab an emesis basin and chucks because, well, this does stimulate the gag reflex, and someone could have a need for those items. Just saying. While you're out there getting your stuff, make sure you grab a packet of lube because that tube isn't going down easily without it. Because we only have 2 hands, you might want to grab a second person to help you hold the cup or the emesis basin and to instruct your patient while you're trying to insert the tube. Bet you thought we were done with supplies, huh? Almost. We need a few things for after the tube is in place. Make sure you have tape or an NG securing device, a safety pin, an irrigation tray with a piston syringe, medicine cup, marker, and pH strips.
Prior to inserting the NG tube, we need to measure using the tube from the bridge of the nose to the earlobe and then to the xiphoid process, and mark with tape or note the measurement. Patient education is important so that our patients know what to expect during the procedure. So explaining to our patients the reason for the NG tube, letting them know that it may cause discomfort, and when it's done, they will have a chest x-ray to confirm placement. Let them know that it is important they stay still, but if it becomes too much, raise a finger. Inform the patient that tucking their chin and drinking water through a straw while you are inserting the tube may help. So now we are just about ready to insert that NG tube. So provide patient privacy, perform hand hygiene, and position your patient, and let's just make sure we've got the right patient. Ask your patient to verify their name and date of birth and verify your doctor's orders. Now we are ready to begin our NG tube insertion. Start by lubing the tube. and begin insertion. Once you feel resistance, offer a sip of water to the patient. Once the tube is in place, take your pen light and check for coiling in the back of the throat. Once the NG tube has been inserted, confirm placement by pulling back gastric contents. Place it in a medicine cup. Dip the pH strip to ensure pH is less than 4. Once placement has been confirmed, mark the insertion length with a Sharpie and pin to the patient's gown. If the patient is on continuous feeding, set the pump according to the doctor's orders. Once the pump is set, connect the tubing from the pump to the NG tube. If your patient has an order for continuous feeding, be sure to check and document residuals according to your hospital policy. Also be sure to document the amount of intake every hour. Check doctor's orders for the rate. Use your nursing judgment to increase or decrease the rate. If residuals are more than 200 mL, hold feedings or decrease the rate according to your hospital policy. Be sure to treat your tube feeding formula like medications. Each bag looks very similar, but each one is different, providing the necessary nutrition for individual patient needs. So what do you do if your order says continuous suction? Well, first, make sure you have wall suction, a suction canister, and suction tubing. You need to know how much suction the doctor has ordered and what the parameters are of how much is too much. Finally, we need to document. Documentation should include how the patient tolerated the procedure, the insertion length, pH test results, and the chest x-ray. Be sure to document the amount of residuals as well as patient intake each hour. We hope we refreshed your memory on how to use those NG tubes. Thanks for watching.